Hey guys, and welcome to a new video of Lil mRNA. This video is about nicotine. Have fun, guys. But what is nicotine? Nicotine is a chiral alkaloid that is naturally produced in the nightshade family of plants, predominantly in tobacco and Dubiosa huburi. Used as stimulant, it's used in vape, shisha, but most importantly in cigarettes. It acts as a receptor agonist at most
Nicotinic acetylcholine
receptors. Also, nicotine is highly addictive, since it involves drug-reinforced behavior, leads to compulsive use, and relapses the following abstinence. Also, nicotine dependence involves tolerance, you have a higher tolerance for nicotine, sensitization, and physical dependence, which ultimately lead to stress.
Why is nicotine so addictive, though? Nicotine is a sedative and a stimulant, but when examining its effect on the nervous system, we will only look at it as a stimulant. After a hit of a cigarette, nicotine enters the body through the lungs and the alveoli and enters the bloodstream. Nicotine works as an agonist or an activator for the neurotransmitter acetylcholine, for which the receptors are present in the central nervous system and the peripheral nervous system. Nicotine then binds to this receptor and thus opens the channels for sodium to enter the neuron. This causes a depolarization. And when an action potential is reached, also the release of neurotransmitters. This process repeats until the impulse reaches, for example, an adrenal gland where hormones such as epinephrine, dopamine, or adrenaline are released. The release of these hormones lead to various effects, such as an increased heart rate, increased happiness, increased cognition, and attention. With an increased use of nicotine, receptors are desensitized, which means that they are less responsive. Increased use also upregulates acetylcholine receptors, which means that there is more of them. This means that acetylcholine receptors demand more activators for the release of, for example, dopamine, and even fewer levels of nicotine cause withdrawal symptoms. Withdrawal symptoms, on the other hand, can be depression, stress, anxiety, irritability, difficulty concentrating and sleeping. A normal mood can only be reached as nicotine levels peak. There are different treatment methods for nicotine addiction. One would be the nicotine replacement treatment, where varying amounts of nicotine are given to the body to slowly reduce the amount of receptors and thus withdrawal symptoms. Also, antidepressants can be used to regulate the release of hormones and thus nicotine's effect on the nervous system and the body. There's also different types of behavioral treatment, such as therapy. All this is said to reduce craving and withdrawal symptoms, and a combination of multiple treatment methods might help even better.